And joining us now to talk more about all of this is our own Dr. Sanjay Gupta. Sanjay, you've seen the video. What do you make of it? It's hard to tell, I imagine, whether it's something or nothing.
Right, but it is very noticeable. I think I'd heard about what had happened before I saw the video, and I remember when I watched the video thinking, this is noticeable. You see her standing there. She's standing, she gets a little bit of, looks like some support from somebody on her left side, but it's when she starts to move really towards the van that you really notice this.
Yeah.
She's very unsteady. She's almost sort of bobbling around, and then I think maybe around that point there, Michael, she's going off the curb perhaps, but she stumbles and seems to fall into the van at that point. So it's very noticeable. But as you said, it's hard to say exactly what would cause this. I will tell you that, you know, with these things, common things are going to be common. So you think about somebody who may be dehydrated, may have low blood pressure as a result, feeling unsteady, imbalanced, and, you know, maybe even nauseated, not feeling well as a result of all that together.
And what do we know about, I mean, there's been a lot of criticism. Donald Trump had the very small letter from his doctor, but what do we know about her health?
Well, we got more of a letter regarding her health, but, you know, I think doctors are like journalists in this regard. We always would like to get even more data. So it's a 2-page letter. I have it actually right here in front of me. It talks a lot about her past medical history, including, I think, most notably in 2012, she also had a fainting episode at that point, hit her head, and developed a blood clot around her brain. So a pretty significant blow to the head at that point. You know, in the world of neurology and neurosurgery, you'd say, well, how is her brain doing now? What sort of testing has been done? And this letter makes note of that and says there's been no sort of long-term impact as a result of that head injury. The blood clot even, which had been present, is now gone. She remains on the blood thinners to make sure it doesn't happen again. But they at least according to this medical note, they look for any long-term impact.
A couple other things, too. I mean, she's had thyroid issues. She's on medication for that. She's had allergy issues. She's on increased, I think, medication for that. Could those medications play into this? Yeah,
I think that they certainly can. And I'll preface by saying, no matter whether it's a big thing or a small thing, when you look at what has happened here, it's still all speculation. Regardless of whether it's something as simple as an antihistamine or something more significant, it's hard to tell, and she doesn't appear to have gone to the doctor to get any checks after this episode. So if I think a lot of people would say, hey, look, out of an abundance of caution, let's get it checked out. But yes, the answer is yes. When you look at a thyroid medication, for example, people who have low thyroid tend to have sort of cold intolerance. They feel cold all the time. They're more lethargic. When you start to replace the thyroid hormone, you're essentially sort of speeding up the metabolism of the body as well, and people can be more likely to feel overheated as a result of that, which is exactly the term the campaign used to describe how Secretary Clinton was feeling. Also, the antihistamine medication, decongestants, they work well. They clear up your congestion, but they also make someone more likely to be dehydrated as well. So you combine the thyroid medication, the antihistamine medication, hot day, maybe not enough fluids in, and it could all work. That would be one of the most common things. But again, any thorough doctor, I think, would say, hey, let's check out, make sure, simple EKG, simple blood pressure check, and laboratory results to be sure.
And you're the doctor, not the political correspondent, but would you think it would be smart to get out ahead of this and be transparent about what happened and what's being done about it?
I think so. Yeah. I think absolutely. I mean, you know, I think there should always be, especially with regard to health issues, being very transparent about it, but also maybe even having her doctor examine her and make sure that there's nothing else. Again, the chance of that is very low, but I think forget that she's Hillary Clinton, forget that she's running for president. Anybody who has an episode like this should probably get checked out. Also, I think it might be wise to have the doctor be able to answer some of these questions as well that are being asked, because the doctor is the only one who really knows her medical history besides Hillary Clinton herself.
And it could put it into context, yeah. All right, Sanjay, good to see you. Thanks so much.
You got it. Thank you.